I understand most of the people here are training managers or involved in that sort of field, yeah? So having someone talk at you for most of the day must be a nightmare, because presumably you're quite activist personalities and you like being heard and speaking and interacting and stuff. So if I ask you some questions as we're going along, you're going to shout things out at me? Yes. Okay, so there's one person at least who's going to shout stuff at me, which is great. Just to give me a sense of who's here, how many of you are in Lancashire or Cumbria or have operations in Lancashire or Cumbria? And how many people are from elsewhere? Okay, so I'll make sure I do a bit of both as I'm going along, because I'm going to talk about Lancashire Mind and what we do, but also I've got some knowledge obviously about what happens in other parts of the country as well, so I'll make sure that I refer to that as we're going along. So just to give a bit of context, there is a large charity in London which is called Mind, and it has a federation of other charities, of which there are about 120 independent charities which have the name Mind. Lancashire Mind is one of the larger ones of those, having come about as a merger from 4 or 5 smaller local minds. So we're all part of one big federation, but we all do have slightly different visions, missions and values. And Lancashire Mind in particular is very focused around prevention. So we were very early adopters of the workplace wellbeing stuff. Our workplace wellbeing offer is one of the oldest ones in the country. A figure lots of people will be familiar with is 1 in 4 people will suffer with a mental health condition. As Lancashire Mind, we believe in mental wellbeing for all. So while we are concerned about supporting those 1 in 4 people who have a diagnosable mental health condition, and we have services for them, we are actually really concerned about the 3 in 4 people who don't currently have a diagnosable mental health condition, and we look to support them too. By the time I've finished speaking, I just want to make sure that you've got some sense of the impact that mental health can have in the workplace, and have some idea about why it's difficult for people to talk about mental health in the workplace, and then to have some skills around what you can do individually and what your organisations can do to make things better for people. So first question, raise your hand if you've got mental health. Good, that's most people. It sounds like a stupid question, but it's an important philosophical point. Everybody has mental health in the way that everybody has physical health. And so our approach always comes from the fact that everyone has mental health. So when we're talking about mental health, let's not always focus on the negatives. Let's remember that there's positive mental health. And people who don't have a diagnosable mental health condition will have bad mental health some days. So hands up anyone who's ever been hungover. That was going to be my next question. Keep your hand up if it's today. Seriously though, things like a severe hangover can induce anxiety. It certainly does for me. Things like the loss of a loved one, going through a divorce, being stressed in work, all of those things can impact on your mental health. So we think of mental health as being on a spectrum where you can be mentally healthy or you can be really unwell. And in between, there are these other stages. And there are different ways of mapping this, and there's different ways, different names that you can give to them. And in the United States, we'd have slightly different language for this as well. But basically, people progress from being healthy into a place where they're coping, to a place where they're struggling, to a place where they're unwell. And in the workplace, that will present in very particular ways. So when people start to get a bit stressed in the workplace, often what happens to their performance when they first get stressed? Often if you put a bit of pressure on people, their performance will improve. So there is a positive pressure. Once that turns over into persistent stress, yes, their performance will drop off. But usually the curve goes like that. It goes up slowly and then it comes down quite steeply. So there is something about observing people in the workplace and seeing when they've gone from being really engaged, coming up with creative ideas, into moaning. Moaning's quite good because you're still getting feedback and it shows people are coping but they're not really happy. And then when people go from that coping into struggling mode, that's often when they'll stop moaning about stuff. They'll withdraw into themselves. They won't be telling you. They might be phoning in sick from time to time. And then when they become unwell, obviously they're going to be phoning in sick a lot. I'm just going to say a few things about language. I'll probably gloss over this slide quite quickly because I put some of the things in the wrong boxes, embarrassingly. But we do tend to use particular language when we're talking about mental health. So we talk about people living with mental health conditions rather than suffering from depression or being a victim of schizophrenia or dyspraxia, whatever it is that makes you knock things off the shelves. And I think that is really important, and it doesn't just apply to mental health either. You know, people with physical health conditions, it does enhance that victim status when you say someone is suffering from multiple sclerosis. Well, you don't know what it's like for them, and you know, it's making a judgment that isn't really helpful. We tend to avoid using diagnoses as pronouns, so referring to someone as an anorexic or a schizophrenic really identifies that person with that label. And in the same way that it would be rude to refer to someone as a gay or a black, it's not okay to reduce someone to something that's really important to them and their identity, but using it as a pronoun. So we would talk about someone who lives with anorexia or lives with schizophrenia again. Something that we try and avoid is using figures of speech that involve mental health conditions, and I do this all the time as well, to be honest. Though I do say I've had a mental day in work, we do try not to do that. There's one particular condition that's come to prominence recently that people use all the time in common speech. It's got 3 letters. Anyone guess what it is? OCD. OCD, yeah. The amount of times I hear people say that, I use a coaster when you've got a coffee cup on my desk because I've got OCD. And you're like, no, you're not a bit OCD. You don't have obsessive compulsive disorder. And actually, people who are very, very tidy, as part of their obsessive compulsive disorder, is only a very small part of that cohort of people. Actually, one of the things we do at Lancashire Mind is we have accommodation for people living with long-term mental health conditions. And one of the issues we face is hoarding. Hoarding can often be a symptom of obsessive compulsive disorder, and that definitely doesn't come with being tidy. It comes with quite the opposite, generally. And just around suicide as well, we always avoid talking about people having committed suicide, because we only ever talk about, generally don't use the verb to commit when we're talking about acts, unless we're talking about crimes or relationships. What's that about? I don't know. So, you know, you would commit murder or you would commit fraud. And this goes back to Victorian times when, in fact, you know, suicide was illegal and people who tried to take their own lives would be punished for that. So, some more questions. How many sick days do we think are lost a year to mental health conditions? Official figures. Someone just say a stupid number. In the UK, sorry. So in the United Kingdom per year, how many sick days in total? How many? About 15.4 million days are attributed to stress, anxiety or depression. That's self-reported. But how many people calling in sick with stress, anxiety or depression are honest about the fact they're calling in sick with stress, anxiety or depression? Okay, how many people, what percentage of people do you think lie and say it's something else? Oh, great. It's over 80. I've seen figures right up to 90% depending on the methodology. All the figures I'm using here are either from the Mental Health Foundation, from National Mind's Own Research, or from Time to Change. So you can go away and check what I'm saying if you don't believe me. So that means, in fact, the number of sick days lost to just stress, anxiety, or depression, we're not even talking about some of the more complex mental health conditions, is about 70 million days per year, or £2.4 billion cost to UK employers. This is a huge impact. People always say to me, but things are getting better, aren't they? Well, actually they are. How many people with a mental health condition are uncomfortable or would be unable to talk to their line manager about that? This has come down. Anyone want to guess? 25. Yeah, those kind of figures we were looking at a few years ago. 58% of people would be uncomfortable doing that, and that has come down. The one I had before was actually 1 in 5 people with a mental health condition report they have been basically harassed out of their job. So this isn't people who've been sacked or let go for capability reasons. This is the number of people who feel that the stigma and discrimination around mental health in a workplace has made them leave. And the corollary of the figure before, so what percentage of employees feel their organisation encourages openness and discussion about mental health is about 41%. So it's kind of the 58% of people can't talk about mental health, 41% of people feel their organisation is good at mental health. There's probably a significant correlation between those two sets of people. One of the worst things about following, the people who are in this room before will know that I've followed a great talk from a guy who works for a design company and said the slides were really amazing, and then I've got my little bits of clip art, so I do feel slightly ashamed. But I think this does show what it's like from two different points of view. One of the biggest and hardest to dispel myths we have when we work with employers around mental health is that talking about mental health is going to make it worse for them. If you start talking about mental health, loads of people are going to come forward, they're going to disclose stuff, you're going to have loads more problems than you started with. It's absolutely not the case. It makes it easier for people and it makes them manage it better. Anyone who's ever worked in HR, you present them with an HR problem, you ask them, what do I do about this HR problem? And they say, well, ideally 6 months ago you should have done this. However, we are where we are. It's the same with mental health. If you do something about it sooner, as an employer, it's going to be better. And for an employee, it's a massive leap of faith. Unless you have set a culture, and unless you have a visibly inclusive culture around mental health, they're going to be thinking, I'm taking a massive risk here. So, a little exercise for you. I'm not going to get you to shout out answers to this, because actually, part of what this is doing is exploring some prejudice that we have around mental health. But what I do want you to do is to go through this exercise inside your own head and think about each of these 4 people. I'll read them out. If you've done some interviews, they're all qualified for the job, but they've disclosed some things along the way. Which of them would you employ and which of them wouldn't you employ? And if you think you might employ more than one of them, who would be most likely to get the job? So here we go. We've got H. H suffers from acute anxiety when meeting new people. He's got post-traumatic stress disorder. This comes from some childhood bereavement and some time serving in the UK Armed Forces. He came close to a complete breakdown at one point, but has got some help. J has clinical depression. She's had a really rough time of it. She's lost her mum, she had a miscarriage, her marriage broke down, and she's ended up living on benefits for a few years. Then we've got M. She had a great career. She was doing really well. She had a complete physical and emotional breakdown. She ended up in hospital. She's diagnosed with bipolar. And then finally, we have W. W's, done quite a stressful job in the past, holding down a stressful job, but he drinks a lot. He has quite depressive character. He drinks an awful lot. Often he'll have champagne or beer or something at lunchtime. So I want you to think about which of those people you'd employ, which you definitely wouldn't, and we'll come back to those in a minute. In terms of stigma in mental health, again, we have come a long way. When we look at attitude surveys about how comfortable people feel living in a neighbourhood with someone who's got a mental health condition, working in an office with someone who's got a mental health condition, those figures are getting a lot better. But not all those stigma and discrimination are the same. So what we see is, with things like anxiety and depression, common mental health problems, people are much more clued up about it. They see people in public talking about it and they're more comfortable about it, so attitudes have improved. With some other mental health conditions, so things like schizophrenia, bipolar, not so much. And then there are other factors, living on benefits, homelessness, drugs and alcohol, that are associated with poor mental health and that actually can cause a lot more stigma and cause self-stigma. A lot of the problem with stigma is people being discriminating against themselves almost. I won't go through the list of things that does to people, but it can result in isolation, not being in work and so on. What I do want to read out is this quote from a woman called Katie who took part in the Time for Change consultation, and I will read it out word for word. I was talking to a guy on a night out and I mentioned I had bipolar. He said, I can't stand you bipolar lot. "You bipolar women are a nightmare." The comment made me feel like I was unlovable and I was broken. It's pretty harsh. So there's self-stigma going on there, because she does feel broken, she feels unlovable, and there's also obviously some severe discrimination coming from somewhere else. And conditions like schizophrenia and bipolar, don't stop people from working, they don't stop them from having families, they don't stop them from getting on with stuff, provided they get the right attention, care and support that they need. So we do have this persistent stigma that is more attached to some conditions than it is to others. So have you all thought about your 4 people from before and who you're going to employ? Did any of you work out there might be real people? Okay. So we've got, the first guy's called Henry Windsor. He's more commonly known as Harry, served in the armed forces, lost his mother at an early age, has been very open about how difficult anxiety has made his life and how at one point he just found it really difficult to talk to someone he didn't know. Now imagine if you had a job where you had to talk to people you didn't know a lot. I think he probably does. And so that was a massive issue for him. He got some help and he's doing really well with that. And he's helping other people by talking about it. The next one's called Joanne. She's more commonly known by her initials J.K. Rowling. She's, according to an American publication, the first billion-dollar writer who ever lived. According to her, that's complete bollocks. According to her, she only has about £600 million. So calling her a billionaire is out of order. Anyone recognise number 3? Any fans in? So Mariah was obviously had a fantastic career and just had a complete breakdown before she was diagnosed with bipolar. And now she's getting on with her career and doing well. She has her ups and downs, as you might imagine. And then W had a very stressful job. He was widely regarded as one of the better prime ministers of the last 100 years or so, although the competition is getting increasingly poor. And he talks a lot about things that we might think of as depressive symptoms now. There's a lot of argument about this because the Winston Churchill Foundation refused to admit that he might have been suffering with depression. But he certainly did drink very heavily and would often have champagne for breakfast before going on to fine wine with his lunch and then dinner. So what can you do as an organisation? Well, we think our vision's right. We would, wouldn't we? But we do think by talking about well-being for everyone is a really good way into this conversation. So don't focus on the negative aspects of mental health to start with. Focus on what things we can all do to be more happy and productive in the workplace. I'll talk a lot more about culture in a minute. Involving people with lived experience of mental health is really important. Involving some champions can be very powerful. There's stuff that you can do around stigma. Time to Change is a whole charity that does stuff around stigma. It has an employer's pledge that you can go and sign. There's some steps you go through around that. And then in terms of education, we always say to employers that managing mental health in the workplace is actually a core management competency. Because a lot of the things that go wrong in the workplace are to do with people. And a lot of the things that go wrong in the workplace are to do with people who aren't happy for one reason or another. So actually managing well-being is essential to that. Culture is really important. And when we talk about having an open culture around mental health, that's about having leaders within the organisation who understand mental health and well-being, but also employees within the organisation who understand that their leaders understand that. Peter Drucker, people may have heard of, he's now mainly famous just for one quote, which is "Culture eats strategy for breakfast." He's actually one of the most famous academics in management theory of the last 100 years. He was brilliant. Loads of the things we take for granted now in management, he invented. But Steve Hatch, who was the MD of Facebook UK, took his quote one stage further and said, Drucker said, "Culture eats strategy for breakfast." I think he's wrong. Culture eats everything. And culture in every company starts with senior people. So don't be scared of talking about mental health. Try to avoid talking about it in a cliched way. Try to avoid talking about it in a negative way or a way that others people living with a mental health condition. but do talk about it, and don't just talk about it in the context of negativity. So what can you do as individuals? Firstly, get some other people in the room with you. Get some senior managers in your organisation to look at this as an issue. Go armed into that meeting with some stats, whether you get them from Mental Health Foundation, from Mind, it doesn't matter where you get them from. Get some benchmark data for what else is going on in your sector, and particularly look at examples of companies who've got this right. Because there are companies who've got this right. There's loads of companies we've worked with who've actually benefited financially from doing stuff around this. As I say, don't underestimate the power of leadership within this. So in order to create culture, it can be really useful if somebody who's at the right stage in their journey with it can talk about their own experiences with mental health. At our workplace wellbeing conference earlier this year, we had a very senior manager from one of the companies we work with come and tell her story about how she had a complete stress-related collapse in the workplace and how she came back from that, and how actually once she asked for support, she did get support, but how terrifying that was for her. And do buy in some expert help, which I suppose is the sales pitch bit, where I talk about what our workplace wellbeing offer is. It's in 4 bits, which are insight and planning, workforce development, leadership development, and embedding wellbeing. So in terms of insight and planning, things that we can do, you don't have to buy them from us, but there are other providers out there. These are the kind of products that are available. They don't all do as much stuff as we do, but we can go in, we can design wellbeing action plans with you, we can work with senior leaders around policy stuff, we can do an electronic wellbeing survey, and for each of these I've given an example. So with Service Care Solutions, which is a big provider who are based in Lancashire but actually nationwide as well, they wanted to understand what was going on for their staff in terms of wellbeing, and by buying us in to do an electronic survey and analysing the data on that, they knew that staff would trust it more because it wasn't them asking. They knew it was confidential. They knew it would be analysed by someone who was outside of the company as well, and so that was quite powerful for them. In terms of leadership development, we can go and we can work with senior managers right up to executive, chief executive, board level. And again, this can be really useful early on in the process if a company's coming at this for the first time. And often this, we might be called in reaction to something that's happening in the workplace. Sometimes we work with employers who are very proactive about this. And we have loads of resources and toolkits and stuff that we can share with managers. An example of this is Booth Supermarkets, who again are headquartered in Lancashire, but work across Lancashire and bits of Cheshire and Yorkshire as well. And there we worked with senior management team, and they're really interested in not just workplace wellbeing for their staff, but for their customers as well. And then the bulk of what we do, I suppose, is workforce development. So actually working with people around mental health in the workplace. So with this, there's loads of examples I could have given, but we've done some work with BAE Systems, with their apprentices, done work with the fire service, police service, ambulance service. So really big employers where employees face really quite stressful situations. Giving them some tools around resilience, giving them some tools around what else they can do in their lives to improve their mental health in the workplace and outside of it can be really powerful, as well as talking about specific workplace stress stuff. And then we have some very popular but more light-hearted interventions as well, like the Work Christmas Survival Guide, our Stress Buster sessions, and so on. And then the fourth bit of it is, a lot of this is to do with aftercare. In terms of embedding wellbeing in organisations, again, there's policy development work we can do around this. There's work we can do to help organisations develop peer support networks and then support people who are supporting other people in the workplace. And we also have a wellbeing coach offer. And this has proved, again, useful with particularly emergency services where people deal with really stressful situations day in, day out. And they have that resilience because they deal with it, but then at some point it just gets too much. Or something that they see triggers something that's so close to their own life that it's difficult for them. And then we can provide one-to-one interventions. We can go in and we can support people around that. And if you are based in Lancashire, there's lots of reasons why you should choose Lancashire Mind, based on our experience. We've been doing it longer than anyone else. Also because we can leverage in funding. So for that stuff like the wellbeing coaching, for those emergency services, we found some additional funding. So the employers didn't actually have to pay for that. We got that in for them. If you're based elsewhere, National Mind has funding pots that can do some of that stuff as well. Most of these services are charged for, but have the conversation. We've just got a big suicide prevention contract from the NHS at the moment. So that's something else that we're working with employers around, and we can provide some free training around that, particularly in industries where, unfortunately, there are much higher rates of suicide. Another really important point about what we do is it is informed by real people's stories. It's informed by people who live with mental health conditions, who hold down jobs, who know what a good workplace looks like and know what a bad workplace looks like. And it's informed by people who don't have diagnosable mental health conditions, who are workers who've been on our programs and who stay in contact with us as well, because we're always constantly trying to improve what we're doing. And just to say, we've worked with, I think the smallest employer we worked with had certainly less than 10 staff, a PR agency. The biggest employers we work with have had more than 10,000 staff, so this stuff is definitely tailorable. So, if you want any more information about any of this, my colleague Karen, who is sat at the back, is here, and probably you can take down our website, our phone number and that, but one of the best things to do actually is just to go and see Karen and leave your email address, and then with your consent we'll send you some more information, and if you don't want to get that information, we're fully GDPR compliant and we won't send you that.